show today. He's a doctor who says he can diagnose you just by looking into your eyes, peering at your tongue, or even by simply pressing your neck. Some call him a medical fortune teller, but his patients say he has the power to heal, even if he doesn't use science. Is it for real? Could his methods cure your aches and pains? He has a high-profile global clientele, a healer to the stars. Sylvester Stallone, Kate Moss, even the royal family, Prince Charles and Camilla, have been some of his clients. But Dr. Mousarf Ali, a trained physician, doesn't use prescription drugs or surgery to cure your ills. Instead, he uses an unorthodox combination of conventional medicine and alternative therapies that has stirred controversy in Europe, where he practices.
I'm not saying that I'm going to diagnose everything, but even if we can diagnose 80% of the ailments, you're halfway there. Let me have a look at your eyes.
Dr. Ali studies his patient's eyes using a technique called iridology.
Any disease process is reflected on the iris, but you must not use only iridology. Quick look at your pulse. We do other systems like pulse diagnosis, tongue diagnosis, ear diagnosis. Then you make an assumption.
One of his most controversial therapies, neck manipulation.
I have a special type of massage of the neck. I massage that area and improve the blood flow to the subconscious brain. Once that happens, then self-healing is possible.
But skeptics argue that Dr. Ali's treatments might actually do more harm than good. So, do his methods really work? How does he heal? And how can you benefit from his controversial approach? Dr. Ali is joining us for his first ever interview on American television.
Thank you very much for having me here.
It's good to have you here. So I should share with the audience that I have been intrigued by Dr. Ali for some time. And I spent some time researching his story. And you have been criticized. Folks, not surprisingly, have concerns about diagnosing diseases with the tongue and the eye and some of the other techniques you talk. How do you respond to those critics?
See, basically, my take is this, that there are certain things like fatigue and pain, fatigue, loss of energy, insomnia, which can't be quantified. You can't measure them. Yes. But, so if you can't measure them, you can't research them. Mm-hmm. I'm not saying that we shouldn't use modern technology, but why should a computer come between the patient and the doctor? Why can't the doctor see the telltale signs on the various parts of the body?
No, it's fair enough. And I think a lot of our audience would agree that too often physicians, conventionally trained doctors like myself, rely too much on technology. So if it's okay with you, yes, I'm going to put you through the test.
Okay.
So let's start off with this whole idea that I'm absolutely intrigued by. I mean, I've always been fascinated by the eyes. They're sort of the window into our souls. But you actually use an older technique called iridology, where you examine the color around our eyes. If we have blue eyes or brown eyes or green eyes, you look at those colors and other patterns in them. So if you don't mind, come join me. And we'll go up to the screen here. And so I'm going to put an image. You can come over here, Dr. Ali. So iridology is an ancient technique, but there are things that we look for in conventional medicine in your eyes, which you can also do by looking in the mirror. So the first, if I can put an image up, see this little grayish ring out there? And it looks a little bit whitish inside of that? That happens when you have too many of the proteins carrying cholesterol, and they sort of get pushed out to the sides there. So people who have really high cholesterol levels will have this little bit of a line there. And the next thing we look for a lot of times, and I see this very often, you see how the eyes look like they're bulging a little bit, like they're being pushed out? That happens when you have thyroid problems. If you have too much thyroid hormone, it accumulates material behind the eyeball and pushes the eye out. So this is a problem that used to be much more common when you had a lot of goiters and the like, but we still see it a lot. And the last thing, just to point it out to you, is if your eyelids are drooping, see how that right eyelid is drooping? We see that a lot if you have neuromuscular problems, so the nerves don't innervate the eye correctly. So these are just classic things that we still have today, but I'm curious about whether or not some of the things you're talking about, which we may have forgotten, may still have some validity. So
yes.
So let's come over. I'm going to show you the tongues. We made you a little model here, and Dr. Ali argues that the second way that he can help diagnose you is by evaluating your tongue. But this is not the way that we're taught in the West to evaluate the tongue. So if you can walk us through
yes.
the general anatomy as you see the tongue.
So basically, the tongue is the mirror of the gastrointestinal tract. What goes on there is reflected here.
Okay.
So if you have the, let's say, the impression of the teeth mark like this, then the tongue is swollen. So it picks up the impression of the teeth mark, and so it is likely that the stomach lining is also swollen. It's a form of gastritis.
So if your tongue is swollen,
Yes.
your intestinal tract is probably swollen, especially your stomach. And the thought being, if your tongue is swollen, what does the tongue touch? The teeth. It'll leave indentations.
Indentations.
And then you'll see other changes on the tongue that are probably similar to the ones you might be seeing inside the stomach. Is that the
Yes.
basic concept?
Yes.
Okay.
Basic.
So, you know what? The proof is in the pudding.
Yeah.
We have a couple patients. I call them patients because they're going to be your patients in a minute, but they're audience members. I know them only by their charts, but I have their medical charts. So I know what in the West we think is ailing them. So if you're okay with this, Dr. Ali, I would love you to have, now you've not met these women, I don't believe.
No.
Okay. So Dr. Ali, how are you?
Hi, good.
Welcome.
How are you?
So he's going to examine your tongue if it's okay.
Okay.
And yeah, what's your first name?
Adriana.
Hey, Adriana. Okay, so I'll be quiet now.
Hold your breath, okay?
No, okay,
Oh.
first let me have a look at this.
So I have all the charts here. And again, I won't say anything until you offer some thoughts.
Okay, show me your tongue.
And if you don't mind, describe this. What are you seeing on her tongue?
In the eye, that I'm going to ask you one question. Did you have any fibroids in the uterus, any cysts? No.
Oh my God, yes.
You've had fibroids?
Yes, I had a hysterectomy, and I had a ton of fibroids when he did the hysterectomy. Yeah.
So
That wasn't in your
Wow.
chart, but okay.
no. That's
You want me to lie?
No, I'm glad you. I'm happy you're telling us what's going on.
yeah. If you look at the ear, it looks like an inverted embryo. This is the head. That's the spine, you know, and this is the diaphragm. So what lies above, in real terms, below, are the organs like kidneys and stomach and all that. Above the diaphragm would be the lungs. Okay, so I'm just going to, because I just saw that there's some amount of acidity. So if I press it just gently, believe me, I'm pressing it very gently. Do you have any sensitivity, especially in this part? No.
No, I feel it.
Okay, you
but
feel it.
Not
but-
sensitivity.
So that is
okay,
nothing.
my neck hurts now.
No, you have a neck issue. I'm going to come to that in a
Now you have a neck
while.
issue. So let me ask you something. You mentioned acid earlier.
Yes.
What made you think that she has acid?
Acid, but show me your tongue. So there's this coating on the tongue, and if you look at this slight bright.
Oh, what we talked about in the tongue, yes.
Tongue, yeah.
You see the indentations there, folks? I don't know if you can see that there.
The indentation. So
Yeah, thank you.
It could be due to consumption of orange, lemon, white wine, vinegar, or eating too fast. Sometimes when you eat too fast, what happens is the food mass has to be churned like a washing machine. The more it churns, the more acid it generates. Right. You know?
So here's the diagnosis that I had.
Yes, okay.
Acid reflux. Is that something you've had an issue with?
Yeah, yes, absolutely. Yeah, definitely. I mean, just right now even, I actually have an appointment with my doctor on Monday because I was worried about this, but I feel a lump in my throat. I feel like constant indigestion when I lay down. I feel pressure on my chest.
So let me ask something. You just had an examination. Again,
Yes.
Dr. Ali, yes, he takes care of lots of rich and famous people, but it's the wisdom that I want to try to take out of this for everybody at home. So I'm just trying to understand, if you were to see him, or someone who is trained like him, what would you be feeling? What would you think?
You know, leaning towards the more natural way to go. I think it's best for everyone's bodies. I felt all the things that he was telling me on my ear, and, you know, I kind of got to give him some credibility, I believe.
Well, listen, thank you very much for
Oh,
allowing us
thank
to
you.
examine you. Hey, hi. Thank you very much. All right, Angela's here. Hi, Angela. How are you? Welcome to the show.
Thank you.
So you have trepidation? Are you curious?
I am curious.
You're curious.
Okay.
Right,
Dark
again,
eyes.
you've not met each other. Just confirm this.
No, no.
Okay, okay. So I have your chart, Angela. and
I
I'm gonna-
live in England. And Italy.
Okay.
So,
So again, you're examining her eyes.
yeah, that's right.
If you don't mind, describe what you're seeing.
Oh,
what you're
okay,
looking
okay. So the first thing I noticed is quite interesting. This eye of yours is weaker than this. See, with the dark eyes, you have to go a little deeper, you know. It's not that easy, but we'll do that. Now, have you had history of headaches?
Yes,
So how often do you get the headaches?
at least 3 times a week.
Yeah, so this has been one of the main things, but also, I'm going to ask you one thing. It could be left or right, did you have problems with the knee?
Yes.
Yeah? What happened?
My kneecap dislocated.
Okay. So we'll just focus on these 2 things.
Why do you think she was having headaches?
Because I saw the telltale signs. And
Teach me, what are they?
So the main cause of the headache, I'm not going to do anything, is this. So this, the place that I'm just touching. It's not that I'm pressing very hard, believe me, Dr. Oz. I'm just touching this area. And so she's had probably a trauma or something like that, a birth injury.
Is that uncomfortable?
Yeah.
It's
So you got to do that. And the second thing you must do.
Before you get to the treatments, you say she has a telltale signs. So one is neck tension, but how else? Here's why I'm asking.
Yeah.
Because after a lot of effort, here's a diagnosis that was made on Angela. Migraines. So I'm just curious how, without any other information, you haven't even asked the questions we would normally ask.
Yes.
How you might be able to tell that she was having headaches like migraines.
Yeah, because I saw the telltale signs in the sense that there was half a ring on this side, and also there was a trauma. Can you recall any fall that you've had or something hit you hard?
No.
Recently fell down the stairs or something?
No, I
Okay.
don't.
A lot of dental work?
Yes.
Yeah. So
How do you know that?
yeah, because
I'm curious, how do you know that?
so the thing is, she's got this TMJ, tympanomandibular joint inflammation, and half the headaches are stemming from that, one half. So some of the headaches are from there, some of the headaches are from mild sinusitis here. Okay, do you have a postnasal drip?
Yes.
Yeah. So some of the headaches are from this. So it's getting confused. It's not just one factor, multifactorial headaches. So sometimes it's this, on other times it's that. So, you know, this is...
So what are you thinking, Angela?
He is right on point with everything. I'm amazed.
So, I don't think... Let me ask you, what would you do for Angela? It's such a common problem that we face in
Yeah,
there.
so first of all, what I would do is, I'll ask her to avoid ice cream, cheese, and of course, I haven't seen the tongue yet, so, you know, maybe some acid problem or something like that, so you avoid that. Then, you need to, as soon as the headache starts, particularly on your left side, you start massaging there, and
Just, if you don't mind, sure.
yeah,
Okay.
this in front of the ears. This is the spot here. So the best thing to do is to put your finger here, open your jaw, and where it clicks.
Everyone do this. Here, put it on me.
Okay.
Okay.
Okay, here, open your jaw, it clicks. So this is the point you massage.
Okay.
Then you must have some neck massages. These ones.
Tell my husband that, please.
Yeah, okay, you can
Where's
do
your
that.
husband?
He's
And
not
just
here.
probably do some yoga. You massage that, you'll be a lot better.
So I don't know how you all feel out there, Angela.
Yeah.
Yeah, you've, I think, had your mind changed a little bit. I don't know yet. And I'm just being reserved because
That's
it's such
all.
a different way of thinking about healing from the way that I was taught, the way all of us in American
Yeah,
medicine were taught. And in fairness, it's very hard to generate evidence, but that said, there's not much evidence that you can look at the tongue this way or the irises that way. But what I do want to applaud you for is that these are ancient traditions,
Right.
and they have been around for centuries. So who am I to dismiss them? And if what they allow you to do, which is what I'm hearing you, Dr. Ali, say several times, is that you're now, because you can use examination to ask your patients targeted questions, if you're able to generate the stories from them and engage them with the trust that you have to have with the person listening to you, right? Because ultimately that's what we have to do as healers,
Yes,
is listen to what our
very
patients are telling us. If you can do that for some of the wealthiest, most elite, royal people in the world, I think all of us can expect the same from our doctors. And that ultimately is a big takeaway message for me. I want to thank you so much for making the visit to the United States to visit with us and sharing your thoughts. Angela, thank you very much. I'll be right back.
Thank you.
Coming up.
I'm addicted to food, I'm addicted to eating, and it's killing me.